okay? Nothing drives me crazier than when people call it a prostrate. It is not a prostrate, it is a prostate. Kind of looks like an octopus. 1, 2, 3, 4. Or squid. Anyhow. So this is urinary bladder and prostate. So obvious urinary bladder is this structure. We have a ureter coming in there. We have the remnant of a ureter dumping into the bladder there. So that would make up our trigon region. These long tubes on either side, that is the ductus deferens or the vas deferens coming from the testicles up to dump into the prostate. This walnut size structure, this is the prostate. And so if you put a glove on it or a glove on and feel it, it's actually a bilobed structure. So there's two lobes that kind of come together. You can feel the depression running right down the center. This is something that you should palpate for in both intact and non-intact male dogs. And so you put a glove on, you go in rectally, right along the ventral floor of the rectum. And as you do that, you're gonna feel this prostate gland. And it should be nice and smooth. It should just have two lobes that you feel. That is what normal feels like. Dogs that are intact, that have urinary issues, these can become cancerous. It prevents the animal from urinating, so we start to see accidents in the house. Usually castration is corrective of prostatitis or an infection in here. Sometimes if it's truly cancer, there's not much we can do at that point. Coming out the bottom end here, this is the urethra. So once these vas deferens, so I flipped it over, the vas deferens come in and they dump into the prostate itself. That's where the seminal fluid meets the sperm itself, and then it's going to come out the urethra, through the urethra, outside of the body. So that is the prostate. Again, in large animals, in cattle especially, if you are semen testing bulls, one of the things that maybe your job is to palpate the prostate and then stimulate the prostate. And so with bulls, it's a little bit different. You're still going in rectally, but you're going to be in a little bit further, and you're just going to kind of like massage it like a lamp, and that will actually stimulate the release and the excitement for the bull prior to putting the electrojaculator in. So I've known some doctors who are really, really good. They can go in and they can collect a semen sample without using an electrojaculator. They'll just massage the prostate and they'll get a sample from it. So just a little bit of more useless information for you. So that is the prostate.